Okay, I'm gonna call Virtual Clinic to find out why they didn't do the administrative stuff. Is it because of their strike they want me to be poor? They think, hey, if we can get more money, we want our patients to be poor so they can understand what it means for us to have still 10 times what they have. Okay.
Welcome to the Northern Health Virtual Clinic. If this is a medical emergency, please hang up and dial 911. Clinic hours are 7 days a week, including statutory holidays
emergency.
from 10 a.m. to 10 p.m. Pacific Standard Time.
And the money Kearney's sending us for food, I'm not going to get access to it because of the CRA and the BC Ministry of Poverty Creation. So,
if you're unable to reach them, our clinic is here to help with other appointment options. Calls are recorded and personal health information is collected, used, and disclosed under legislative authorities. Your PharmaNet records may be accessed if needed to support your appointment needs. Violent and or aggressive behavior will not be tolerated. If you do not consent, please hang up. To book an appointment, press 1. If you require mental health and or substance use support, we will connect you when a team member becomes available. Please stay on the line. Northern Health.
hello. Hello. Can you hear me? Hello?
Hi.
Oh, okay, that was weird. Okay, so it's Martin here. Hi. I just talked to a doctor, and he said I have to book an appointment to repeat this again. Last time I talked to a nurse from Virtual Clinic who booked the appointment with this doctor. I guess she didn't do what I asked, which was to pass on the request for him to fax something somewhere so I could get coverage for dietary supplements. So it's to try this again with you guys.
Like a special authority?
It's the BC Ministry of Poverty Creation. They didn't include my dietary supplement, an additional, I think it's $65 a month. And I guess the doctor has to kind of fax them something. It doesn't have to be an official form. It could just be from his notepad, just saying this patient, needs to watch what he eat. And the one I just talked to, aside from knowing I avoid lactose and I avoid gluten, he's now putting me on iron as well because it's still a bit low. Yeah.
Do you happen to know what the doctor's name was?
Diane? D-A...
Dan. Okay.
Yeah.
D-A-Y-A-N.
Yeah, he ran out of time, so it could be him again if you want. I mean, he just got... But he said to ask you guys why it wasn't done last time, and I'm thinking it's the strike or something that made the administrative work not get done. I don't know.
Not sure about that because one doesn't have a lot to do with the other. Your last name is that Paraso?
Correct.
Okay, so let me just quickly read all the doctor's notes here.
Because it looks like it'll be a second month because of these delays for me to get that money. And the money that Prime Minister Kearney's sending us for groceries, I'm not going to get it because I'm having trouble with the CRA not auditing my file for the last 8 years. So that means there's a whole bunch of benefits that go through that I'm not getting. So that means you guys please do this because $65 extra per month for my benefits is important because I only work 4 hours a week this week and 3 hours last week. I just work a couple hours every Tuesday morning. So
patient, I'm reading that and I'm kind of confused.
Poverty doesn't help me and my health very much.
Okay.
If only I had a fourth post-secondary degree.
Okay. No, that's fair. I'm just trying to...
And last time, I could dig up the phone again, but last time I had the lady repeat the fax and she got it. So it's just faxing it, just a doctor faxing it with my information on it, saying this person, for various reasons, qualifies for extra needs for dietary supplement. I just told him the list of things I'm taking to see if it's good with the other medicines that I am now on. So.
Oh, I see. Okay.
So they used to have a form, the ministry, but now they just don't mind that it's just a fax going to the fax number I gave. Do you still see it in the notes from last time?
Well, yeah, I'm trying to read everything. Do you mind if I put you on hold and see if there's somebody that might be able to speak with you now?
Okay, I won't go look for that form again if you think you could find that information in the notes.
Okay, yeah, if it's in there, it should be in there, but I will look for that as well, okay?
Okay.
Okay, thank you. Hi, Martin. Thanks
Yeah,
so much
hi.
for holding.
Okay.
There was something available that was gone before I got to it, so that's great. With that being said, my earliest available appointment, it looks like it's going to be at 8 o'clock on Friday evening.
Friday this
if
week.
that doesn't work for you, I think I got a lot of open Saturday, I believe.
Friday evening this week. Yeah, okay. Same doctor?
No, it wouldn't be. It would be with Anita Siphon.
Okay, but it'll be, she'll read a lot of the notes and I'll save time re-explaining
Right.
everything. Okay.
Okay, now just so you're aware, there usually is a fee for any kind of a note being sent.
Yeah, I'm not going to be paying a fee. And if I have to pay a fee, I'm going to send an invoice to Northern Health just that I'm stuck with them for living here, right? Because I'd prefer getting a doctor outside of Northern Health at this time. I'm tired of firing doctors that work for Northern Health, so.
Right, but that's the area you're in, so that's they're all going to work for Northern Health.
Well, then I'll also charge them for relocation fees because I've documented on my YouTube so many failures of Northern Health. I mean, eventually, the data's there for a judge, right?
I see. Okay. Yeah, so I can put you into that appointment. Let's see.
Could that explain the games that were played before, that people are trying to get money out of the poor to give to the rich? That's part of the culture of Northern Health.
I don't agree with that, but that's neither here nor there.
Well, I could show you my bank account for the last year, and you'll see kind of the difference of what I'm talking about. Like to actually try to get money out of somebody that's poor, and months passing where they don't get access to that supplementary income for nutritional stuff. And also the Salvation Army here doesn't give healthy foods. Plus, I don't get access to the carny money that you guys are getting for groceries right now. So, you guys think about it, what the Hippocratic Oath is, and you guys figure it out. But I'll be there on Friday. What time?
7:45.
In the evening.
And yeah, if you bring up any of this stuff about lawsuits or anything like that, we will be unable to assist you, just so you're aware.
Okay, and if you guys trying to extort money out of me, again, it's not going to be a good fit,
sir,
right?
Yeah. I'm going to hang up because this is totally obsolete to trying to help you out.
Well, you gave up pretty quickly on a patient, I tell you that. So this is what I have to deal with. Yeah.